eczema is something that affects 1 in 10 adults and 1 in 5 children, and is a condition our next guest has been battling with since birth.
Now, Amy Aston had been managing her symptoms with steroid medication, but in January this year, Amy says her usual steroid cream suddenly started to burn her skin, making her eczema the worst it has ever been.
Yeah, so she hoped stopping her medication would resolve the issue. Then it made it worse. She was hospitalised and left fearing for her life after experiencing severe withdrawal symptoms.
Now, Amy joins us now to share her story alongside dermatology expert Dr George Moncrieff. Welcome to both of you.
Oh, thank you.
Thank you so much. I mean, I just said in that very sentence, her eczema flared up. And I'm just going to come to you, George. Is it eczema, the flare-up after using the steroid cream?
Well, that is precisely the controversy. And the question is, yes, if you've got an inflammatory skin condition that's being controlled by a treatment like topical steroids and you stop those steroids, it will almost certainly flare back up again. And that's the view of most dermatologists, that they're seeing these patients whose skin's become inflamed, and if only they'd put the steroids back on their skin, things would calm down and get better. But the patient knows their skin, they know what's going on in their body, and they know that putting the topical steroid on in this condition is what's causing the skin to become totally unstable. And so it's a completely different entity. Not common. We don't know how common it is because there isn't a label for it that the profession has accepted. And so we can't do prevalence studies for this. But I think it's a lot more common than is acknowledged by the profession. And in this condition, the skin just becomes really wild. It becomes red all over, far more widespread than the eczema was. Red, painful, a pain beyond anything they've ever experienced. Itch of a different intensity, peeling, red and weeping and utterly inflamed. And it's not that putting more steroids on would calm that down. They would bite your hand off to have topical steroids if that was the answer.
OK, well,
it's the topical steroids that drive it.
Let's hear Amy's story, because this is what this is a lived experience. You've been through it. You've been on social media talking about it. When did you first notice that you suffered with eczema?
So, as a baby,
yeah, so all your life.
Yeah, I've basically grown up with, diagnosed with eczema, and I've got various other things, like allergies. I've got celiac disease, so kind of autoimmune things going on with my body. But obviously, from an early age, my mum was given steroid creams to use, and she did so, from the advice of the doctors, and I've continued to do that, up until January.
And how was it working for you up until then? Like, did you feel the benefits growing up with it? Yeah.
So lots of people describe it as magic. They'll say that cream is magic. It gets rid of your, eczema, and but for me, it just, there was a turning point over the last couple of years where I just felt like it was that withdrawal. My skin it would heal, but then it'd come back with a vengeance a few days later.
Even though you were still taking it?
Yeah, and I'd put more on
to
try, or I'd be given a stronger steroid cream to use, and it's just obviously progressed over the last couple of years and got worse and worse.
How did this affect your life?
I'm surrounded by so much support that actually I feel quite lucky in the fact that, my work are so supportive. My husband is my absolute rock, and my family, my sisters, and I've got such a good support network that I'm really lucky in the fact that they've supported me. But my mental health over the years has been so up and down because of my skin.
Yeah.
Cancelled plans, with friends.
Oh, I know.
Watching my children growing up, when I've just recently been in hospital, my daughter was about to take her first steps. And I was so worried that I was saying to my husband, sit her down. If she looks like she's going to walk, sit her down. I don't want to miss it. So, it's...
So you couldn't even lift up your baby?
No,
because it was so sore?
No cuddles. They knew, so they'd try and come to me and say, can I just give you a bit of a hug? And, yeah, I wouldn't wish it on my worst enemy. It has been horrendous.
So, Amy, when you withdrew and you came off the steroid cream, how long did it take before your symptoms got a lot worse?
So I stopped using them. I decided to stop using them myself in January.
Because of the pain?
Because of the pain it was causing when I was putting it on, and I felt like they were making it worse.
Yeah.
So I just listened to myself and said, why am I doing this to myself? So I stopped. And it probably took a month for it to become at the height of the worst of it, where I was getting the symptoms of like swelling in my face, my glands swelled up, you know, the burning sensation, but feeling freezing cold. Probably took a month to get to that stage, so it just got progressively worse over that amount of time, really.
So is it affecting your throat and everything, like being able to eat and stuff like that?
Yeah, I was in a lot of pain with my glands, you know, everything swollen. So yeah, it was affecting me in every possible way. It was affecting me, basically. Sleep, couldn't sleep because of the itching, oozing from every part of my skin, you know.
Oh, my goodness.
George, so this is topical steroid withdrawal, right? The TSW. So it's not much is known about it. There's not an awful lot of research done about it, correct?
Correct.
So what do you think needs to be done? What can be done to help people like Amy?
Well, I think a number of things need to be done. Obviously, it isn't always topical steroid withdrawal.
Yeah.
So it can sometimes be an inflammatory skin condition that's been suboptimally treated. It could be an allergic reaction to the topical steroid, and that is described to topical steroid molecules. But there's this specific entity, which Amy has just described beautifully, and is devastating from the patient's point of view. A study showed that 16% of patients with this contemplate suicide. That's nearly 1 in 5. And part of that is because what I think needs to be done is the medical profession has been, to a large extent, blinkered to this diagnosis, partly because we don't know how to manage it. We don't know what to do. And for years, we've used topical steroids for inflamed skin, and that's our go-to thought. And suddenly, this is the thing that might be driving it. So we feel incapacitated. So the profession needs to accept it and listen to our patients and respect our patients and work with them, not against them. I've even had parents of children with this condition. It's usually young women between the ages of sort of 18 and sometimes under 18 up to sort of 35, more than men, but it also affects men, typically younger people, and mostly affects the face and the genital area, delicate skin areas, which are awful. And often they don't get much good response from the medical profession, so they don't come to us, so we don't know how often it is. But it can affect children. And I had the parents of a child who the doctors reported them to social services because the parents refused to put more topical steroids on their skin. And they weren't doing it because they knew the topical steroids were driving it.
And is there an alternative?
There's this war going on, and with social media and the medical profession, we need to come together. And the British Association of Dermatologists and the National Eczema Society have been working fantastically to produce some guidance and some leadership here, and had written some position statements and working with the medicines MRHA, who license products, to try to get some acknowledgement of what's really going on here, so the profession can start to work effectively with their patients rather than against their patients.
Amy, is there anything you take now? Where is your life now? Is there anything that works for you?
That soothes you. And anybody out there who's in the same position, what would you use now instead of the steroid cream?
I wish I'd got the answers, but I can obviously only describe what I've been sort of doing over the last couple of weeks, but it's things like, so Dead Sea salt baths, when I'm oozing, that really helps to kind of like stop that, and it's soothing, or oat baths. That's kind of the only time the itch kind of goes away, sitting in a bath, but trying not to stay in too long. I've bought myself a scratch star from Cozy Care that's it's supposed to help with the, my nails, at my skin.
Okay.
It's a softer, and they've got a nice smooth roller as well, so I've been using that. I've been trying out different creams that maybe, I think it's a shame because it's a case of trial and error to find a cream that is suitable for your skin. But different types of emollients. There's, the creams side of things as well.
Can I just
like I say, I wish I got the answers.
I do not want the message to go out there that people should stop their topical steroids. Because I could not manage skin disease without using topical steroids. And for the vast majority of patients who use a topical steroid, they are fantastic. They don't smell, they're really powerful, they're clean, and they're inexpensive. So for the vast majority of patients who have a skin disease that can be controlled with a topical steroid, they should continue to use them as recommended by the doctor, the right quantity, in the right strength, in the right areas. We shouldn't stop that. But when this happens, I'm delighted to hear that you can do this to your skin, because a lot of people say their skin is so sore they can't even wash.
Yeah.
They can't put their skin in water. And putting an emollient on, which is normally soothing, stings intolerably. So this is a different, specific entity that needs a lot of research.
Well, Amy, thank you so much
So
for joining
painful.
us.
Thank
This
you.
was
That's
the
okay,
best.
yeah.
I really
Just hope
appreciate you
that
coming today.
Can help,
Of course.
some people out there
Thank you.
as well.
Yeah.